Okay, declare the meeting open to the public and welcome members to the 57th meeting of the Public Accounts Committee in this 22 to 27 mandate. Advise members that the committee meeting will be recorded and broadcast throughout Parliament buildings and online. However, there could be a slight delay as we move into any private session or back into public sessions, so please be patient. I advise those in the public gallery they are welcome to use mobile devices as long as they are in airplane mode and all devices are muted. They can continue to use they can connect with the Assembly Wi-Fi password with details available on the gallery rules. It's not permitted to take photographs or record any of the meeting. So members will proceed just through the agenda. Item number 1, apologies. We have received apologies from Daniel McCrudden MLA and Carroll Boylan MLA today, and see everyone else is here. Agenda item 2, draft minutes. I refer members to the pack for a copy of the draft minutes of the meeting of the 20th of November 2025 at pages 7 to 12 of the meeting pack, and I would seek members' agreement on the draft minutes. You agreed? Agreed. Okay, so agenda item 3, declaration of interest. I just remind members to ensure that they've considered the full agenda for the meeting and that any relevant declarations are made early in the meeting to ensure that they are recorded in open sessions. Members, any declarations?
So I'm bringing forward a members' bill in relation to homelessness. I'm also chair of the Committee for Communities, and I own a property from which I receive a rental income.
APS, the Communities Minister, just chair.
Padraig?
Yeah, Chair, just similar to before, have a few relatives who are GPs and also a family member who was a former BMA rep for the North of England.
Any other declarations? No? Thank you very much. We have no chairperson's business, so we'll move on to item 5, matters arising. Refer members to page 16 of the meeting pack. There's correspondence from Neil Gibson, the Accounting Officer for the Department of Finance, regarding the outstanding memorandum of reply on our report into major capital projects. Members received this on hard copy in last week's meeting, and this is it into the pack. And I would ask members if they are content to note Neil's letter today alongside the correspondence previously received and the independent effectiveness review, and review it in more detail before the evidence session that we have scheduled with him in the new year. Are members in agreement with that?
Yep.
Yeah, thank you. I refer members to page 3 of the table pack to correspondence from the Northern Ireland Housing Executive, providing some further information following the recent evidence session on homelessness in Northern Ireland. And just want to say it's really good to see this coming in through so quickly after the session with a lot more detail, and we'll review it in due course. I would ask members, are they content to note this letter and forward it to the Northern Ireland Audit Office for inclusion in our final report? Great, yep. Thank you. Agenda item 6, correspondence. If we could refer members to page 47 of the meeting pack, there is correspondence from Gráinne Long, CEO of the Northern Ireland Housing Executive, advising members of a declaration of interest made under the NIHE's declaration of interest process in respect of the inquiry into homelessness in Northern Ireland. This is effectively the reciprocal of the declaration that we discussed in last week's meeting, and if members are in agreement, we will note this declaration of interest and publish the correspondence alongside the final inquiry report. Are members content? Yeah, yep. Thank you. So agenda item 7, inquiry into homelessness in Northern Ireland, our evidence session. I refer members to the documentation in their packs with suggested questions at page 48, which we've discussed, witness biographies at pages 51 to 53. Northern Ireland Audit Office report on homelessness in Northern Ireland at pages 54 to 139, and the Northern Ireland Audit Office briefing paper on homelessness in Northern Ireland at pages 121 to 130, and the inquiry terms of reference at pages 137 to 139. Welcome our guests to our meeting. It's brilliant to have you all here today as part of our PAC inquiry into homelessness in Northern Ireland, and I welcome Nicola McCrudden, CEO of Homeless Connect, Mark Bailie, Head of Policy and Programmes, Homeless Connect, Jim Dennison, Chief Executive of the Simon Community, David Carroll, CEO of DePaul, and also like to welcome Dorinnia, Carville, the Controller and Auditor General for Northern Ireland, and Stuart Stevenson, the Treasury Officer of Accounts in Department of Finance. So Ms McCrudden, Mr Bailie, Mr Dennison and Mr Carroll, just welcome to PAC today, and I thank you for agreeing to attend the committee, and just like to hand over to yourselves. You want to make some opening remarks?
Thank you very much, Chair. Good afternoon, members, and I want to thank members for giving us the opportunity to brief this afternoon on the Audit Office report on homelessness. Homeless Connect, as many of you might know, is a representative body for the homelessness sector here, and we also provide a range of direct intervention services, homeless prevention services, and one of that would be Fair Share, for example, and we distribute surplus food to people in need throughout Northern Ireland. So 700 tonnes of food are distributed to charities and schools and hostels here. So we're acutely aware of the scale and impact of homelessness and poverty facing this society. Members, as you will know too from your constituency offices, that we are in the midst of a housing and homelessness crisis, and the Audit Office report starkly outlines the scale of this challenge. To state an obvious point, there are far too many people living here and not being able to access affordable and secure housing suitable to their needs. Too many people are going over the edge into homelessness, and with all that means for their mental health and well-being. And far too many children are living in temporary accommodation and the consequences that comes with that. And we acknowledge that Northern Ireland is not unique in the challenges that it faces when it comes to homelessness, and the PERMSEC for DFC and the Chief Executive of the Housing Executive outlined the challenges during their session a few weeks ago and provided helpful comparisons to other jurisdictions. However, with that acknowledged, it remains the case that the number of households with full duty applicant status has grown by a staggering 135% over the last decade. And in August 2025, almost 62,000 individuals made up of 32,000 households on the social housing list had homelessness status. And to give a sense of the scale of this, you could fill the SSC arena 5.5 times over with the number of people that we're talking about. All three of our organisations work collaboratively with statutory and public sector partners, and solving homelessness must be done in collaboration across sectors and across departments. It would be uncharitable and wrong for us not to recognise the challenges faced by our statutory partners, and in particular the Housing Executive, and there has been positive and progressive changes in recent years which have made a difference. However, the Audit Office report does raise several important questions when it comes to the homelessness system, and I'm pleased to say that there has already been positive progress when it comes to some of the recommendations set out in the report, but we believe there's still further to go. Broadly speaking, there are 4 main areas covered by the Audit Office report: governance, housing supply, prevention and temporary accommodation. And with your indulgence, Chair, I'll briefly touch upon governance before handing over to Jim and then David. When it comes to governance, we noted the comments of the Permanent Secretary 2 weeks ago when he acknowledged that there are challenges with the governance of the homelessness system as it stands. He referred to the number of groups and terms of reference, and we would go further. We need a governance system which helps our public and statutory organisations to effectively collaborate and cooperate to prevent and reduce homelessness. The system as it stands today is nowhere where it needs to be to respond to the challenges that we are facing. As our briefing outlines, we believe there are 2 significant problems with the current governance arrangements. Firstly, that the oversight group at the top of the governance system, which is the Housing Strategy Steering Group, or I'll use the acronym HSSG because we all do love acronyms, it's attended by officials who are not able to make decisions on behalf of government departments who are represented. And this leads to considerable frustration and slows down progress. If it is a priority for the Northern Ireland Executive to prevent and reduce homelessness, senior staff, at least of the rank of Deputy Secretary or equivalent, should be engaging in the structures seeking to bring about that outcome. And secondly, we believe that the HSSG should be independently chaired. The Department has ultimate control over the agenda and how an issue will be discussed and debated. As our briefing said, this ability to frame the discussion is a subtle one, but one which can be overlooked. But it is crucial in terms of the effectiveness of such group, and all departments should be held to account, including the Department for Communities. Other jurisdictions have independent chairs for their equivalent bodies, and we believe this would be a valuable step to take. I'm now going to hand over to Jim Dennison from the Simon Community.
Thank you, Chair and members. I watched very intently the session that you ran 2 weeks ago with the Housing Executive and with the AFC. And that input started with numbers, and then the questioning from you turned to people. And I think it's important that I try to marry both of those, because when we talk about households, I believe it to be misleading. A household, as you know, can be one person, it could be a family of 6. So I'm going to add some colour to people here, because that's what it's about. And then I'm going to talk about housing supply, because I think we've got into a narrative that we got into this crisis 5 years ago. We haven't. We got into this crisis a long time ago, and we haven't got out of it through some decisions that we can change. The Housing Executive referred to Simon Community asking under FOI questions about people, and we've been doing that now for 2 years. The most recent stats, which we got today, this morning, bring us up to September of this year. So just to talk about people and rather than households, the social housing waiting list as of the end of September this year is 90,819 people. Those in housing stress are 71,394, and those deemed legally homeless, i.e. FDS status, is 62,314. Of that number, nearly 20,000, 19,657 are under the age of 18. We have a huge generational problem here, and we can see it clearly. Very often official stats will point to presenters, and we are led to believe that if presenters come down, we're dealing with the problem. We're not, because FDA status, and that's the number that I think you need to watch most carefully, has been going up month on month on month, and I can provide those for you if you wish. What does that mean for us as a homeless charity? So we're the largest provider of charitable beds here in Northern Ireland, with 484 beds per night. We took a snapshot of demand in 1 week of this summer, and we had 4 beds become available during that week. Such is the lack of throughput of housing options, so people are getting stuck in emergency accommodation. During that week, we took 364 requests for accommodation. That tells you that demand and supply just simply isn't there. And if you want to query why the bill for non-standard accommodation, i.e. standard with no support, is going up, you might want to look at that figure, because I don't know the other 360 people who we couldn't accommodate. I don't know where they are, but they must be somewhere in the system. This is a rising problem, and it's one that we need to watch very carefully. Could I also suggest as well that reporting on people now become part of the public narrative? We ask under FOI, and to be fair, the Housing Executive provide those stats. I think if this is a human issue, we should also be moving to presenting on those figures on a quarterly or very regular basis as well. So the supply issue has been around, and I know you know this, but it's important context. In 2002, the Housing Executive stopped building, and that building responsibility transferred to the housing associations. At that time, the Housing Executive had 110,000 homes. The housing associations had 20,000. Fast forward to now, the Housing Executive has lost about a quarter of its stock. It has 83,000 homes, and the housing associations have 61. So we went from 130 to 144. So in the last 20 odd years, we've only extended our social housing stock by 14,000 homes. You can see where the pressure is rising, because we have a rising population anyway. And when you mix in pandemic, wars, economic crisis and other things, you can see how that exacerbates. I want to just talk then about today's homeless bulletin, and just to provide you of where we are against housing supply aspirations. In the first 2 quarters of this year, we started 41 homes, 1 in the first quarter, April to June 2025, and 40 in the second quarter, July, September 2025, and we completed 503. For an aspiration of delivering over 100,000 homes in the coming period, we're falling well short of that supply. So this is not a new problem. It's a problem that we started many years ago. We still allow right to buy to lose housing executive homes, and we're still underinvesting in social housing stock, and that's why we're in a homeless crisis. Thank you.
Thank you as well. David Carroll, I'm from DePaul, Chief Executive, and despite this accent, I've been working in Northern Ireland Homeless Services for the last 23 years. I'll focus specifically on the issue of temporary accommodation because the audit report very much focuses on that, and there's no harm us kind of reminding ourselves of the issues in terms of the total expenditure in temporary accommodation in 23-24 was 38.6 million. Expenditure on hotels and B&Bs accounted for 12.2 million, a 13-fold increase from 9 million in 2019, and spending on non-standard accommodation has soared from zero in 2015-16 to 45,574 per day in 24-25. Understanding how we've got to this place is important. It's been consequences of the epidemic, role of demographic change influenced by migration, which has to be examined through a positive lens. The absence of government and wider macroeconomic environment does not help. But fundamentally, the failure to plan ahead and invest is at the root of this issue. The failure of not truly treating this issue as a crisis will have longer-term consequences for the public purse, but importantly, the households and the communities that we all serve. We're in a reactive and emergency paradigm that the Housing Executive operates in, that has allowed the proliferation of profit-motivated private sector interest. Why has this happened? I think the private sector can respond far quicker than the NGO sector, which has no financial muscle to respond. All of us are in deficit positions with no real access to bricks and mortar, and weak relationships exist with the housing association sector body, who they themselves are facing huge challenges. But we have to contrast the open wallet approach taken with the private sector against how the NGO sector has been treated in relation to our costs and our role in delivering the homelessness strategy and temporary accommodation. Despite a cost of living and recruitment and retention crisis, there have been minimal increases in the supporting people pot that has barely kept pace with inflation. And I have a couple of examples of where we're under specific pressure in providing and in the absence of full cost recovery as well. So neither supporting people or housing management fund will fund water costs, which leaves us raising donations of 20,000 per year. We are disallowed from providing any emergency funds for someone in distress, and we have to raise 20,000 against that. Stella Maris, our support accommodation unit, has to raise food costs that are far beyond the ability of our service users, and we have to raise 60,000 on that. And because supporting people don't pay for food, they disallowed 4 bottles of water we provided when an MLA came to visit our service a few years ago. There are also exclusion of the NGO sector from the provision of any temporary accommodation. There have been little opportunities, even though we are a housing-led sector, and we obviously believe that temporary accommodation ultimately shouldn't exist. But there's only been, I suppose, 3 projects in the last number of years: the Dime project in Derry, Londonderry, a woman accommodation project whose tender price was set at such a low level that it was impossible to bid for, and a current call for crash beds. DePaul, for the first time in 6 years, have expanded its service portfolio for a community transition service for women leaving prison. And this housing-led pilot is completely funded by charitable funds. Finally, after 2 years, a Housing First piece of research will be launched in this House on Monday. Let's see on Monday if there's a meaningful plan to actually commit resources or targets against this. I would be delighted if that occurred. DePaul launched its first Housing First programme 10 years ago, but there has been a failure to invest in any meaningful way in a capital or revenue investment in Housing First. What is not spoken to any great degree are the consequences of being in temporary accommodation for long periods of time. A study that we did with the Simon community in 2023 found that 68% of people experiencing homelessness have a diagnosed mental health condition, compared to 19% of the overall population. Temporary accommodation is challenging enough environment, which has the human cost of delayed child development and educational attainment. It worsens mental health and drug and alcohol problems by not addressing the issue of adequate high standard temporary accommodation, we store up problems for the future, both for the exchequer and the individuals themselves. Temporary accommodation needs trauma-informed environments and independent owned-door settings. Non-standard accommodation and B&B accommodation does not provide this. The role of other departments is key. Nicola already has spoken about the role of the Interdepartmental Homeless Strategy Steering Group. There aren't senior enough figures sitting around that table in order to make it meaningful and for it to have power. And there's been little committed funding towards the whole issue from the health sector. Housing First, if it is scaled up, will not have the impact it can have without significant health input. So just to kind of summarise what happens now, there is a strategic action plan that was published for temporary accommodation in 2020. We want that report brought back on the table and an evaluation of what supply is needed and a costed exit plan to minimise the use of private sector. If we know how much it costs, we have something to aim for. And alongside that, we also need to assess and cost how much it would cost to introduce Housing First significantly. Targets need to be set. Again, if we know how much it costs, we have something to aim for. There needs to be a ring fencing of 100 properties from the 600 properties that the Housing Executive Plan are purchasing for Housing First, even though they won't be permanent tenancies. But it's hugely important that we focus on people with complex needs. I call on the establishment of a housing commission now to bring together all of the different facets and disparate elements of the issues we face. I really truly believe that a subcommittee of the Stormont Executive, chaired by the First and Deputy First Minister, to drive and lead a new reviewed interdepartmental homeless action plan that has teeth is needed, and we need meaningful investment from health and the PHA. If we allow this current issue to continue, the costs will not only be in financial terms, but more importantly, will result in human suffering and an attack on dignity. Thank you.
Thank you all for that, and thank you all for the work that you do on all this. It's absolutely invaluable. And as we were sitting as a committee planning our approach to this report, obviously we've had the departmental officials, the housing executive in, but it was very important for us as a committee to hear the actual voices at the cold face of it. So we really, really appreciate you coming here to be able to do that. And Jim, just touching on something that you had said, the officials had told us about there being around 31,700 homeless households, but I totally agree with the point you made, and Daniel McCrudden had brought it out in the last session. It's not just about households and generic numbers and data, it's people. It's every person has a story, every person's had a crisis. It could be on anybody's doorstep. You don't know how circumstances are going to change or how crisis is going to hit. And I think you had some really useful figures there. I was going to ask around, the full extent of this, but if you could share, that some of that data with us. I know you had read some of it out, but it just really, just wanted to build on that a wee bit more, like the full extent of the issue. You've got some stuff through FOI, just the scale of the issue here in Northern Ireland.
Absolutely, happy to do so, Chair, and thank you. So, as I say, we've been on a journey, and unfortunately we do have to ask it under FOI because they're not readily available stats. I don't like the term, as I said, household, and I don't like the term unit. We're talking about people's homes. I mean, none of us here after the busyness are going back to our units. So we need to talk about people because it's a people problem and we need to talk about homes. So back to your question, Chair. December 2023, FDA status, we had 55,589. Jump forward to June 2024. That number had increased by nearly 3,000 people, 58,241. Christmas, then 2024, 59,518. June of this year, summertime, when we did that snapshot, 61,698, and today, right up to September, 62,314. There's a real issue here. If you had all of those individuals, and I know that Nicola gave that analogy of filling the SSE, if you had all of those individuals in one place, it would be the 5th largest town in Northern Ireland. That's what you're dealing with.
Absolutely, I think it's important that as we are bringing this report forward, that we're quantifying the full extent of the issue and looking at the real numbers here. In terms of our report here, we've been looking at the homelessness strategy, and the officials told us here in committee that there was no evidence that the homelessness strategy had failed. Would you agree with their assessment?
Firstly, I would like to say that all of us were involved in the development of the homelessness strategy. There was really good consultation and involvement from right across the sector, right across the homelessness sector. And we believe that it is a good, strong, robust strategy, but like anything, it needs to be properly resourced, and I think that's largely the problem. We haven't seen the full resources being put into the delivery of the strategy, and on the other end of things as well, it needs to tie in with the housing supply strategy, because we cannot solve homelessness if we aren't building enough homes, and our concern is that at the minute we're not currently building homes. In fact, there will be a backlog building up just because of the figures that Jim has just given you. So ultimately these two strategies need to relate to each other, but again, it's not just the homelessness strategy, it's the interdepartmental homeless action plan. All of you know that we cannot solve homelessness unless there's cross-departmental support. So it goes back to my opening remarks around the governance arrangements. Department for Communities, it is their interdepartmental homeless action plan. We are all involved in helping to develop, but they chair the group that has oversight for that plan and also has oversight for the homelessness strategy. So as the Permanent Secretary said in earlier comments, we do think it's time to review. It's in the Audit Office report as well as a recommendation to review those structures and to look at the possibility of having an independent chair. In Scotland, for example, an equivalent group is co-chaired by the Housing Minister. So, given the scale and the size of the situation that we're facing, and our concern is that it'll only get worse if we're not building enough homes, we do think that an independent chair or someone who's of senior kind of significance would be really helpful in terms of accountability around that. So I don't know what any of my other colleagues wants to come in at this point.
I think the point around the homelessness strategy cannot kind of lie in isolation and relationship to others. I brought up specifically the issue of health, and if you look at the reasons in terms of why people come into homelessness in the first place, health, drug and alcohol issues, mental health are major contributory factors, but also as well the role that health has to play in supporting people both in temporary accommodation but also to support them once they go back to the community as well. And it goes back to what mechanisms do you have in place in order to be able to coordinate an overall integrated plan. At the moment, as Nicola has said, the Department for Communities is really in isolation. There's I suppose the relationship with other departments is not on a mandatory footing. And going back to the point that I made, I probably would go further than even Nicola. I really feel that if the programme for government is addressing this issue, it needs to be taken as an emergency and treated as such by the Assembly, and an interdepartmental plan, of which the homelessness strategy is part of, alongside supply, alongside a health strategy, alongside the issues around infrastructure and around housing supply, needs to be pulled together in a far stronger way. That's accountable to the First Minister and Deputy First Minister's office and driven as such, in order to be able to bring the departments together. And echoing the representation on that interdepartmental group needs to be at a very senior civil service level.
Sorry.
Sure, could I just add to that, if I may? I think it would be unfair to say that the strategy has failed because it's so interreliant on other things. But I will make one observation, not particularly about housing, but I will use it as an example. We are very good, and we've been traditionally very good here at producing strategies. And what we tend to do is we have a variety of different strategies that run at different timelines with different owners and different funding pots. And we're falling foul of that in housing now, because what we have, for example, we've got housing and homelessness names in the programme for government, which is fantastic to see. And in no particular order, we've got the DFC Housing Supply Strategy 2024-39. We've got the DFC Annual Interdepartmental Homeless Action Plan. Sorry, that's a mouthful to get out. We have the draft corporate strategy for the housing executive, 25, 26, 27, 28. We've got the draft supporting people's strategic intent, 26, 31. We've got the ending homelessness strategy, 22, 27. We've got the strategic plan for temporary accommodation, 22, 27. And we've got the youth homelessness action plan, 24, 27. Now, if you're trying to track outcomes across all of those things, it becomes incredibly difficult. And what I find is very often we'll sit in different rooms with the same people talking about different metrics. And what we have to do is be outcome focused, and we need to get a clear, measurable plan together, because we can't work like this.
No, absolutely. Just bring in other members now. Stephen.
Okay, thank you, Chair. Thank you, folks, for your presentation. We have heard some detailed technical explanations of homeless prevention, but I suppose we're keen today to hear your own direct experience. And I suppose I would just say, having visited the Simon community in my own constituency recently, I've seen firsthand the good work that you do. So we want to just put that on record. But I suppose, what does effective homelessness prevention look like in practice? And could you share some examples of successful early interventions and prevention strategies that are currently being implemented here, and that that could be implemented right across the country?
Maybe I'll start on that, and then others will come in. I think in terms of homelessness prevention, it's critical that we make the strategic shift to prevention. The best form of prevention is upstream, long before people reach homelessness. And there are some really innovative schemes coming forward as part of the Homelessness Prevention Fund. I'd mentioned one of our member organisations, Max, is running a programme called Upstream in North Belfast, based off a scheme a number of schemes that's been operating in other jurisdictions. And basically what it involves is a universal survey of all of the young people at secondary school, and basically it's a survey that everyone answers, so there's no stigma attached. It's not aimed at just those that are viewed as being of having fewer economic resources. But it's designed to allow for interventions much earlier in the system, because part of the problem has been that we haven't had consistency of funding for homelessness prevention. I think that would be the way to put it. As you'll probably be aware, with the Homelessness Prevention Fund, there's been quite a big swings. We've had this year there's 2.5 million, but then the year before there was no homelessness prevention fund, and often it's been short term and reactive, and that's just not how you fund effective homelessness prevention. But there's so many different areas, because homelessness obviously has so many different drivers and causes, but there are effective schemes out there, and if the funding was available, I know our sector would take it forward. It's all about having that consistent long-term funding to really make a difference earlier in the process.
I probably would go further downstream and talk about the role that institutional care and support has in the prevention of homelessness, and specifically looking at the prison population and early intervention and release planning is key. The establishment of the community service that we have now for women leaving prison is a key example of that. Young people leaving care, we should have a very clear idea of the trajectory of young people who are in the care system and when they're about to leave it, and their independence, and hospital discharge protocols as well, particularly for people with complex needs, where we know that a person can be kind of assisted and helped and not discharged necessarily into temporary accommodation. But works with projects such as Housing First, and we really welcome the publication of the research on Monday on Housing First. But as compared to many other jurisdictions in Europe and the UK, we've not moved as fast on this whole area as we should. It has three elements, I suppose: revenue from the housing executive, revenue from health, but also a really kind of clear planning in terms of how the housing comes on board for that particular group. I would go back to the call for the housing executive to use some of the 600 properties to ring fence it for Housing First tenancies, because they are probably the individuals who have the greatest complexity and are probably in some circumstances the most difficult to move on from temporary accommodation as well.
Okay, thank you. And just I suppose that ties in with the next question around the prevention and the measurement of it. And I suppose the officials reiterated that point, that it's difficult to develop an agreed definition of prevention and it is difficult to measure. So just be keen to hear about your experience of the monitoring and the outcome assessment performed by the sector on prevention measures, and why do you think it's proven as difficult as it is?
I think in terms of the measurement of prevention, it is possible that there are definitions that are out there, and I think the CEO of the Housing Executive referred to that. And again, I think part of the difficulty has been that it takes time to embed the sort of change. But one point I would make is that we need to be careful not to tangle up different funding streams and say that everything is prevention, because it's not. There's only some elements of what is being funded would be rightly described as homelessness prevention. So I would just be saying that, so for example, references to supporting people, a lot of supporting people it can't be described as homelessness prevention, in my opinion anyway, because it's providing, if you're providing temporary accommodation, that's not preventing homelessness. So that's a big part of the supporting people funding. So I would say that it would be worth your while to try and press to make sure that we're not just tangling up these different elements when we're talking about prevention. I do acknowledge there is a challenge in defining it. I'm not denying that, but I don't think that we should take the idea that supporting people as prevention and just accept that as a statement of the full situation.
Thank you.
I think you can measure prevention in certain ways, and let me give you a couple of examples. Quite a few years ago we developed a tenancy deposit scheme, and what that was is us putting up a modest amount of money for people who couldn't secure a home in the private rented sector because of that barrier, that financial barrier. That has since grown and supported now by the Housing Executive. It's been supported by charitable trusts, and 2 weeks ago we gave out our 700th deposit. So we have moved 700 people and families into private tenancies. We can show a 96% success rate. So we're keeping their own tenancies, they're paying their own tenancy, paying their own rent, so it's keeping them out of temporary accommodation, and we can calculate roughly how much the cost of temporary accommodation is. So you can put a number on it and you can show the effect of it. We also, a number of years ago, as our response to the homeless crisis, set up a wholly owned subsidiary called Creating Homes, and that's exactly what it does. We buy property and we create homes for people who are in our temporary accommodation, those individuals who are ready and able to live independently. And we've bought 30 homes in the first instance. We plan to double that over the coming period. What we can show, and it was the pre-runner to the LAMA programme, ours was almost the template, we can show that if you move from emergency accommodation and all the support required there into your own home and manage it, there are cost savings of around £14,000 per home. And we're doing 30, so when you do the maths, we're saving the public purse about £500,000 per year at no cost to the purse, because it's on us and it's our borrowing, and Exchequer will get that money back. Now that will be ramped up gladly. The only issue is with NAMA, it's very difficult to get, and whilst it's 10 million and it's modest, that could be ramped up. It could be easier for our organisations like ourselves to get out, because we can actually deliver meaningful impact that you can show and save you costs.
I think the metrics around advice centres and advice lines is a really clear metric in terms of people approaching and getting advice, both from the likes of the Housing Rights Service but the Housing Executive themselves, where people are in genuine difficulty either from a legal point of view. The existence as well of floating support services, where we're actually intervening specifically within the community, is a really kind of clear metric as well for people who may be kind of running into neighbourhood disputes, rental arrears, where floating support actually intervenes with as well, and that's throughout Northern Ireland as well. Those services actually exist. So the metrics are there. It's how you define them, I suppose.
Okay, thanks folks, thanks Chair.
Thank you both. I think that that's really important point. Is a really good example, Jim, because I think that we're going to have to be, creative to get these agreed measurements of what actually is measuring prevention, because preventing homelessness is like preventing crime, preventing anything. How can you prove that you stopped something from actually happening? So those sort of metrics and ideas are really, really good, and appreciate those examples. John?
Yeah, sir. Thanks, really, really enlightening, by the way. I have a couple of follow-ups, but I'll ask these two questions first. At our evidence session with officials, they told us they were deeply committed to prevention. Has this been demonstrated in your experience when working with statutory bodies, particularly the Housing Executive?
I definitely believe that the Housing Executive and the Department are fully committed to preventing homelessness. I've been working in housing and homelessness my entire career, and this is a repeat conversation that we tend to have, and sadly it does become a resource issue, and it does need to be properly resourced. The annual budgets certainly don't help the situation. If we get into a 3-year budget cycle, then we can really start to try and make a difference through funding coming down through the likes of ourselves and others to implement these programmes. The Homelessness Prevention Fund, our organisation Homeless Connect, applied and secured funding for that. We have a programme starting this week called Fresh Foundations, but that funding ends in March. So this is a brand new initiative which is basically providing a credit of £600 for people who are at risk of homelessness to be able then to purchase essential household items or food from ourselves, and then work with our partners Greater Change in England for anything above and beyond that. It could be driving lessons, it could be a training course, because homelessness, I think we need to be clear about this, is very firmly linked with poverty as well. So the situation we're at the minute is the lead-in time is much shorter than we would have liked, and the funding will run out in March. Now we have been told that there is the Housing Executive do want to continue with this, and if the funding is there, that will continue. But these short-term funding cycles don't work. It's very difficult to then demonstrate the impact of that. There's a lot of good work happening in Simon Community and DePaul and other projects as well. And as I say, I do believe that our statutory partners are committed to preventing homelessness, as are we.
Yeah. Okay. Second question then. Officials tell us there's a strategic shift towards prevention is now needed. Okay, are you getting a sense of that shift in strategic priority on the ground? I mean, do you actually, it's a similar question, but do you actually get the feeling, is it in the language, is it in the direction, is it just words, or is it being operationalised as prevention, being discussed?
My belief is it is being operationalised. Yeah. We're still early days with it, I guess, in terms of having a homelessness prevention programme. I would like to be involved in shaping what that programme would look like in terms of its strategic priorities, along with colleagues in the sector as well. So we'd be keen to engage with the Housing Executive and Department on what a homelessness prevention programme would look like. And I think we need to take a little bit of time to get that right, but maybe some of my other colleagues would like to.
I just add just to note the scale. So we're talking about £2.5 million for the Homelessness Prevention Fund. I know the Housing Executive bid for £4.5 million, and it was only £2.5 that was granted. But you've heard the numbers. Is that meeting the scale? That would be the question that I think should be asked.
Just to clarify, you think the absence of a 3-year funding cycle is an inhibitor to proper prevention?
Yeah, I mean there are other matters at play as well in terms of like the local housing allowance rates. Like we were deeply disappointed that in the budget they continue to be frozen. So if you're trying to prevent homelessness and at the same time people are struggling to pay their private rental sector rents because of the difference between what will be paid through benefits and the widening gap, so it's not necessarily just a level playing field. People will still struggle to be able to pay their rent, and there will be affordability issues because of decisions that are being made at Westminster.
Just two things. One, you mentioned the tenant deposit scheme, which was the requirement to have a deposit was an obstacle you've got, which I think is very good. Increase in pets, people having pets. A lot of private landlords don't take pets. Is that an issue? Does that cause some people not to be able to get into a house and then be homeless or not?
I haven't heard examples where that has happened. So I couldn't specifically answer the question. I think there's more of an issue around the requirements, because some landlords are moving from 1 month to 2 months, and in some cases 3 months. There are issues.
This is deposit.
This is with the deposit, so that is an inhibitor. There's also an issue about guarantors, issue around references. So it's actually more bureaucratic than pets, to be fair.
It was something come up in a constituent of mine. I just wanted to. Now, let me just ask this question. Strategically speaking, the government started increasing taxes on landlords. Mm-hmm. Right? So there's a lot less write-offs, and for a lot of people it became less economically viable I had a rental property by accident largely. But the tax system was punitive to try and put people off being private landlords and having second homes. But actually, so has there been a reduction in private landlords? The amount of housing stock that's owned by lets? So does that
You bring up a
policy?
really legitimate kind of question around the future of the private rented sector and where it is going. I think that accidental landlord group will find it more and more difficult in order to be able to upkeep their properties, and there's less of a tendency to take people on housing benefit as well. But also as well the role of the private sector and institutional kind of investors kind of going forward is a key issue, and but also a question that I would have the role of cost rental schemes as well, and where we go with regards to that, because that's a very much a way in which we can lessen the reliance on the private rental sector as well. So
My last one, I promise, is
Yeah.
to make this really simple for me. Do you see if a pie chart of 100 people who are homeless, is there really accurate stats to say 12 of those for every 100 is because of a gambling addiction, 5 of them are because of domestic violence? Do we really understand the risk factors that causes homelessness per every 100, typically? So therefore, those individuals, when they start presenting to a statutory agency, say domestic violence, the first report, that flags up when there's a risk of homelessness. So what sort of information does the police have to give? Or someone's diagnosed with X, well, that's a risk of being homeless, that's a risk factor. Are they getting the following information? Do you know what I mean? Do we really have the detail of, for every 1,000 people who are homeless, what exact percentage is gambling addiction, drug addiction, PTSD?
It's not broken in that way. It's categorised in a particular. It's obviously a set of
In a broad
categories
way.
in quite a broad way. Although again, it is worth saying that quite a bit of that information, there is quite a lot of it is identified. But perhaps there are legitimate questions to be asked about the way that's done. But I would say it's not the collection of stats that's really the biggest issue for us. I would say it's more addressing what we're seeing coming through.
But I'm saying, if you want to shift left, you actually understand what is causing you to be here and presenting homeless. Well, then we actually need to understand granular detail of that to then say, where do we make the intervention there?
And to be fair, it is up. I mean, the housing executive carries out assessments, so everybody who's presenting as homeless will be interviewed as such by the housing executive, and it comes down to the information that's then divulged to the housing officer at that time. So that's what the housing executive is working with. You know, so it's very much depends on the reason you're presenting. If it's to do with domestic abuse, if it's to do with addiction, if it's to do with how the person will then communicate that.
And centrally, so I look at the pie chart and say, for every 100 people in Northern Ireland, 2 of them is because of gambling addiction, 12 of them is because of domestic violence, 16 of them is because of alcohol addiction, 14 is because they've got a health problem. So then we actually understand what we're dealing with. How can we, that information needs to be, those causation factors need to be known.
Housing executive will have quite a bit of that detail, that's my understanding.
So we as, I'll speak from Simon Community's point of view, we will know the cause and effect of homelessness. So we will know in people, because we do very detailed support plans. So we talk to them about what has happened in their lives, what are the current issues, and how do we support those individuals to move on. So we will have really good granular information on that. However, that information isn't collected across the piece in any meaningful way. It isn't taken up into the system. It's not distributed because, as Mark alludes to, it's broad themes rather than support needs. And sorry, could I just jump back to your last question about the landlords and the rising cost? We're seeing that rising cost causing homelessness because people can't afford spiking rents, and we don't have rent capping on it, which it's a cause, and it's also then stopping people from moving out of homelessness because they can't afford those high rents. So it's an issue, and we see that because the length of stay in our accommodation is nearly a year now in emergency accommodation. So the private rental sector isn't an escape route for people who are stuck in that poverty trap.
Thank you.
I think also you bring up a really legitimate kind of question with regards to planning going forward. Yeah. So, for instance, if we're going to cost truly the introduction of housing first on a regional basis, we need to know how many of that cohort require that sort of service. So, I've been working from probably the figure of 400 to 500 in the last kind of couple of years. Very much kind of a rule of thumb, but a forensic kind of examination of this needs to occur.
Thank you. And just a quick one from me. There seems like there's a lot of metrics and information that's available across the voluntary community sector. Do you feel like the department's effectively using that?
One of the challenges is the collation of that. I know that supporting people will actually have quite a lot of this data. That would be my understanding, but there are ways that it could be utilised better, I feel. And I think that's something the Housing Executive is aware of in terms of data collection, and there is some work ongoing around that. That's my understanding.
That would be good. Tom, do you want to jump in? I know you have to go up to your question.
Thank you, Chair. What impact has reduced prevention funding in recent years had on your organisation and other people that you help that are homeless?
With reduced funding, it means that it puts a pressure on us as a charity, because the last thing that we want to do is to reduce our services. And we do fundraise to put money into that. So when you live, as Nicola said, on an annualised basis, when you're waiting to sometimes months after the start of the financial year, it can be very, very difficult to plan, difficult to commit. We can do more with more. We know that with more we affect savings and we change people's lives, but the difficulty is when you cut off that stream, it makes it incredibly difficult for us to keep providing that service.
The issue in terms of funding is key, not only within prevention services but within the more kind of temporary accommodation sphere, and the absence of full cost recovery is a huge problem, and recruitment and retention is a key issue for us to be able to deliver the range of services that we have. And unfortunately, as with Jim and the examples I gave earlier on, we have to fundraise in order to be able to subsidise services on behalf of the state, but also as well we have no ability as well to be able to be benchmarked against the public service, for instance, in terms of salaries, and we're in huge kind of difficulties on that. And I've been calling for a while now that with any kind of changes in the public service salary rates, that the NGO sector needs to be taken into consideration automatically, as well as an examination around pay parity. So we are in huge difficulties in terms of staffing with the general funding issues that we face.
What level of homelessness would this reduction in funding have caused that could have been prevented?
It's difficult to quantify that. It really is, because one prevention, whether it be a float and support intervention to keep someone who is perhaps suffering from a life-changing addiction in their property, to a prevention to give people the wherewithal to move into a private rent sector are two different things, and that is the point where it's difficult. We're not comparing apples with apples, so it's difficult to quantify that question, but it's one that we need to take away and think about, because we need to be able to answer it. I couldn't give you a specific answer on that without guessing, to be honest.
Okay, thanks, Tom.
Sorry, I have to go.
Yeah, thank you. Patrick Delargy.
Thanks, Chair, and thanks for your answers so far. As been mentioned earlier, they've been really useful, and I think they've really contributed to all our knowledge of the topic as well. So, look, thanks very much for that. And I had been going to focus kind of on the shift left, but I'm aware that you've covered that in quite a lot of detail already. So I'll maybe start on the other 2 points, and then if we have time, come back to that. The first point I wanted to look at was around the Scottish bill. I know it's been held up as somewhat of an example of that shift left and how homelessness can effectively be tackled and people can be properly supported. So it was just to get a better understanding of what specific aspects of that bill you think would be beneficial and what could be replicated here in the North.
Yeah, I'll take it first, and then colleagues can come in. Our homelessness legislation goes back to 1988. As you probably know, the Housing NI order, the world has changed quite substantially since then. Scotland has had several housing and homelessness related bills in that period of time, and we haven't had the full comprehensive review that we need to see around homelessness legislation. So that would be something that we have called for publicly, and we would urge the department to take on, would be to do a full comprehensive review of our homelessness legislation. Scotland would be one of the jurisdictions that we would look to. The particular aspect of their legislation, which is quite innovative and we're very interested by, is what's known as Ask and Act, which is a duty that's been placed on a number of statutory bodies, including, for example, the Prison Service, the Scottish Police Service, and health bodies, to ask individuals about their housing needs, and then to act on that information, to pass it on to the relevant authorities. Again, that's an effort at trying to get upstream, trying to prevent people entering the system before they face the real challenges that they can have, you know. So again, Scotland, they're very much a progressive. Their legislation is very much progressive. We would urge looking at it. It's not the only model to look at, but certainly the recently passed Ask and Act is what you're wanting to look at.
And if I could come in there just around prevention. So we obviously know that the Housing Executive's primary duty is to house people where they're investigating priority need into temporary accommodation, and then FDAs into temporary accommodation until they're rehoused. But we would be keen, going back to the conversations that members have had around prevention, that we do have a duty to prevent homelessness, because that means that funding will and should become available to help prevent homelessness happening in the first place, and also a duty to cooperate across government departments, because it shouldn't just be a prevention duty on the Housing Executive. It should be a prevention duty on health and justice and other services as well. So we'd be keen to see something like that introduced here.
No, that's really interesting, and it's good to understand the specifics, because I think sometimes like looking at the overarching bill can be really informative for us, but it's actually understanding what makes it work well. What are the specific parts of it that we can maybe replicate here, because it's obviously a system that has a lot of parallels with our own and even demographics. So it's something which we can certainly look at. My second question really was on interdepartmental working, because there's been some sort of limited success in that sphere, and obviously opportunity for a lot more. So I suppose two parts to that. Firstly, where do you think the blockages lie? And secondly, where do you think the opportunities lie? So do you think that there's more opportunities with health, education, and so on? And how do you think we best tackle that? Because one of the perennial problems, I suppose, that we look at in this committee is the silo working sometimes between departments, and how we need to actually have an all of government approach to this, which I think, particularly for homelessness, is critical.
A really interesting question. And if we think about what happened during COVID, we would have thought that the response would have been through the Homelessness Strategy Steering Group to that, because that has cross-departmental representation, but that didn't in fact happen. I wasn't in post at the time, but I came in to help the sector in terms of the coordination of its effort through colleagues. And actually, I'll just pass over to Jim now, because Jim was the person behind creating a new group to help coordinate the homelessness response and the health response. So maybe, Jim, if you want to...
Yeah, absolutely. So COVID was starting to emerge, and there were three homeless charities that joined together, and we asked officials to come from, and TAFED was one of them. We asked individuals to come from the PHA, from the Housing Executive, from PSNI, from a whole kind of gamut of different kind of government departments and other officials, and they all came. And they all came with sufficient seniority to be able to make decisions. And very quickly we stood up that group. We didn't have the technology to do it. There were 15 people on calls on loudspeakers, but very quickly we were able to make decisions, and which affected the communications of how we all interacted. We were able to push for changes in legislation. We were able to push and justify funding sources, and it worked incredibly well. And the uniform view around that time was we need to keep that going, because that is a model of really good practice of regular quick thinking and quick action, and it disappeared as society normalised, as COVID kind of left our lives or left the centre of the stage. we all went into our own silos, and despite attempts to get that back and running, it didn't happen. And I think it didn't happen for two reasons. People fell into the trap of their own busyness, and people fell into the siloed departmental working that they have. And I think a way in which you actually tried to get that back is to look at homelessness differently and where it touches each of the departments, particularly on the public purse. David will recall, going back as far as 2019, we, along with Professor Dermot O'Reilly, suggested that there's a way you can use data mapping, existing data within departments, to count the cost of homelessness to health, to justice, to housing, and wherever else it touches. That has got no traction, despite being presented to no fewer than 3 parsecs. And I don't know why that is. My whole basis is, if you have a sense of the total cost to our public purse, you can look at it differently. It's not about asking more money, it's about spending it differently, and we just get that resistance. We don't get it. And it's interesting because one of the officials said last week that they know that the new approaches on homelessness has affected savings in health and justice. If you know how you've made the savings, you must know how much you're spending. So if you have a total look at the budget, I think you start to have a different conversation, one that which is actually about collaborative working, because at the minute it doesn't. Each department has their own pressures, their own interests, and it just doesn't connect in a meaningful way, or a way in which it should.
Can I follow that from Jim just with a brief point? I mean, it's worth asking the question, why was the HSSG not the body that led on the response to COVID? And I think that's a legitimate question to be asked, and again, it's to do with seniority. And in terms of effective interdepartmental working, that is what we need. We need the right people in the room. We need people, the senior staff in the room. It is very frustrating going, and it's not personal. It's a structural thing. We recognise the commitment and diligence of a lot of the officials involved, but they aren't in the position to make commitments to take things forward, and it slows everything down. In terms of your opportunities question, there are opportunities in some of this right across these spaces. I really passionately believe that if we could improve interdepartmental working, we could really make a difference in those spaces. There's some examples, particularly in the justice space, where there's been some really good collaboration, and it's largely because justice officials, they recognise the impact of what's happening, on the ground, on their department. And again, it needs to go further. They would be the first to say that, I'm sure. But there's so much more that can be done.
If I could just come in, and I think all the members are aware of Complex Lives, and the real significant strides that project has made, albeit on a smaller scale. It's chaired by the Chief Executive, Belfast City Council. We're all on that group, aren't we? There's very senior Chief Executives right across the board who come together, who are passionate about bringing about change, and if it can happen on that scale, then there's no reason why it can't happen on a wider scale.
And sorry, just to come in on the complex lives piece, I think there's where it works well, it works really very, very well. I think the opportunities do lie within the drug and alcohol strategy and how that's implemented, particularly around substitute prescribing, fast tracking around substitute prescribing, safer injecting within Belfast City Centre. There's a tendency that we react rather than are proactive. Complex Lives has been established on the huge crisis that we have on the streets of Belfast. And I would love to see Complex Lives being extended, for instance, to Derry, Londonderry, and the whole kind of initiative, well, to be funded properly, because we're going from quarter to quarter on Complex Lives. It's not staffed adequately, but it really is an opportunity to be able to integrate all of the different kind of aspects and threads, such as safer injecting, such as policing, such as first responders, community safety, under one umbrella, and I think as a concept needs to be pushed forward by the Assembly.
And just the last point for me, and I think it's important that we do illustrate examples, but they tend to be isolated examples. We work very closely with health trusts here to provide the Housing First for Youth programme, and we're the only ones doing that particular work. So it's working with young people with complex support needs to live independently in their own house, independently, albeit with a bit of support from us. That's funded through health. There's a recognition there, and it's funded through health because health have the statutory duty to look after these individuals, and they discharge us through us. So there's really, really good examples of it. But if you were to bring that together in a really collegiate and really kind of responsive and really strategic and properly funded way, you would make a real difference on this. You absolutely would. We're not just getting that joined up approach.
So I think that's really useful, and as always, your knowledge and experience is, I think, what is going to make this report really useful and actually kind of carry that weight. But for me, the group that you mentioned originally, I think understanding what went well in that group would be really pivotal for us as a committee. So just through the chair, I think, if any detail could be sent on that, what you felt worked really well in that, I think that would be really beneficial, because to me, that is the recommendation, is what has already worked well, what has proven success, and what has been seen to be effective. So I think it would be useful if any more sort of specific detail, and I appreciate we can't go into all of that at committee today, but could be sent on, and I think it's something that we should certainly look at and review as a committee. But thanks very much for your time today and your comprehensive answers as always.
And just to say, Chair,
and I was just going to say, any written evidence to follow this would be welcomed, especially across the board. And any examples that you have of different things would be appreciated.
We've actually contributed to the COVID inquiry, so that information is available. We'll be able to pass that on.
And I'm happy to share the origins of the multi-agency group as well, and what happened and what we achieved, and then what happened afterwards. So I can do that.
Okay, thank you, Colette.
Yeah, I suppose picking up on that, it seems that the departments all decided to work really sensibly together during COVID, and then once it was over, decided to stop all that. So there is merit in doing the simple things and doing them well. My question was going to be on the prevention of homelessness, statutory duty, in relation to that, but you've already made it clear that you do think that would be beneficial. So I appreciate that. I am working on a members' bill in relation to intervention in terms of addressing homelessness, but I think the two go hand in hand. So instead I'll ask then, so 2 weeks ago we heard from DFC officials that the Minister is of the view that the Right to Buy scheme should remain in place. What's your view of the Right to Buy scheme, and do you think there is potentially should that be ended, amended, or even suspended?
Speaking from Homeless Connect perspective, we would like to see the end of the Right to Buy scheme, and have done for a number of years. If we're not building enough homes, we shouldn't be allowing social homes to be taken out of use. So it's that simple for us.
We share that view. If you think back to the start of the session where I talked about 110,000 homes down to 83, the statutory authority, at one time the biggest social landlord in Europe, has been losing stock, and I think we have to pause this, because we are not making up the numbers to replace those stock plus add to this. So yes, I absolutely think we do.
I concur with that. I think the issue that ultimately will result in us being able to reinvest the money that's been spent currently on temporary accommodation has to come on the basis of supply. Has to. That's in order for us to recalibrate and reinvest the money that's been put, particularly into the private sector, and somehow we have to create the space by which that money can be reinvested back into a prevention strategy. I think the hemorrhaging of social housing outside of the system is no longer acceptable.
Thank you. And the final one from me then is around the prevention budgets, which I also raised with officials in our last session. And I think we all agreed that given we're not investing enough in prevention, I think that's broadly accepted, that and given it's a reasonably small budget, any uplift in that could have a significant impact. Now, I raised it in communities this morning with budget finance officials from the department, and there is some interest news in terms of the 3-year budgeting. And increases in that, and I certainly would welcome any increases. But what's your view in terms of the potential for that over a 3-year cycle rather than the year to year? And also, are the department engaging with you to ensure that you can scale up should further funding become available, as I certainly hope it does, that you're in a position to utilise that funding?
I think there's huge potential. If we've got 3-year budgets, I do agree we need further investment, and the housing executive, annually bids to the department, and I would like to see that annual bid, accepted going forward for those 3 years. As Jim said and David said, it allows us to plan and allows us to scale up. I think our sector innovates really well and we collaborate really well, so there's huge opportunities for us to work together, and that's the way we work, and that's the only way we're going to be able to prevent homelessness, is to work together in a planned way and in a properly resourced way. In terms of the department engaging with us at the minute, I can only speak for ourselves. I haven't had any conversations with department officials or the housing executive, and even my staff are asking me what happens beyond March. Will we get additional funding? When do we have to apply for the funding? Because we're into Christmas now, so you're talking about the last quarter, and as all of you will know, that's a really busy time for year for us and for anyone, but for us then to pull together a 3-year funding proposal, it takes a good bit of time, and we want to make sure we get it right, because it is for 3 years. So yeah, that would be my contribution. I don't know whether anybody else wants to.
I agree, spot on.
Thank you, Colin. David?
I was going to ask you about the practical implications of not having that plan for yourselves. I suppose we talked at the start about people, and this is about people. So can you just take that a little bit further of what that looks like on the ground without that fund in place?
What we would like to do, and it's very much core of our business, is to work with people who've lived experience of homelessness, and we talked about people, and I'm very keen to make sure that people who have lived and living experience of homelessness are actually given the opportunity and the time to help to develop these innovative solutions, because unless you've walked in someone's shoes, unless you've actually experienced homelessness, you're only really commenting on it. So I think that would make a huge difference, to give us time to be able to plan these programmes and involve people who've lived experience in developing that. It is really challenging for us. Some of my board members come from the private sector, and they're tearing their hair out at times, thinking you couldn't run a private sector business this way, not knowing sometimes where funding's coming from, and not knowing how to plan ahead. So we've become very skillful in juggling. So I mean, the longer lead-in time we have to this, the better. And saying that, programmes don't have to be set in stone as well, and there is a need to be flexible around this. And I was very keen, when I was in a meeting at the housing executive, I was very pleased to hear a housing executive official saying it's okay not to do things right and to do things wrong. And I think part of our culture is it's almost like a blame culture. So you, in terms of evaluation, myself and members, you want to portray your best, possible scenario, that you're doing things really well. It should be okay to say, do you know what, we tested this and it didn't work, and this is why it didn't work. And in retrospect now, we know what to change and we know how to learn from that. So I think that all takes time. And at the minute, it doesn't feel like we've got a lot of time. But again, I just feel that there is a huge opportunity here. If we have this 3-year funding, it's important to make sure that we get it right. But if it's not right, that we can be flexible enough to change things for the better.
Can I add one thing to that? There was a period in 2024-5 where we were operating on monthly budgets, which was incredibly challenging. It was to do with an issue around the voluntary community sector funding being pitched against spend on temporary accommodation, which obviously is volatile. And to his credit, we went to the minister and said, this is crippling us. This is really causing us significant issues. And he addressed that issue. We got annual funding, and the difference that made in our organisation is that we were able to recruit staff in a way that we couldn't when we're operating on these very short time horizons. That's a very simple example of the kind of difference it can make. And over 3 years, we're much more likely to be able to recruit staff rather than on these short-term, contracts.
So what we do is we hold off. We hold a lot of vacancies because we don't know what budget we're going to end up with at the end of the year, and it takes a long time to recruit. So we end up holding vacancies, and then that puts additional workload pressure on the staff.
Can I tease that out? Because you're talking about recruiting staff, but what about the retention staff? So you just talked about people coming from private sector and coming in. Is there an issue then
one of recruitment, but the retention of who you've got, of the expertise, of the skills there, and the skill sets there, retaining them and keeping their expertise within. Has that been an issue?
Well, there's two elements to this. One is that we can't keep pace with others. The kind of analogy that you'd be better off working in Lidl than ourselves because of the huge challenges that people who are coming from a low paid perspective, and the issue in terms of recruitment of staff. I think Foylehaven in Derry is our day centre, which provides a huge preventative role in terms of identifying street drinkers and early intervention for rough sleepers as well. This year we for I think the second year in a row we've got annual funding, but up to 2 years ago we were on a quarter by quarter basis. And not only does that have an effect on our staff, it actually has an effect on the service users who are actually saying, are you going to be here for us in the next kind of couple of months? Because we had to say to them, people were on protective notice, for instance. So that's the actual impact of staff kind of saying to you, you know what, I'll be better off in another sector. And people are staying because of the love of the work and the commitment to the values of the organisations and the commitment to the service user group rather than the salaries. I go back to the point in terms of pay parity has to be an objective for us. And a link to public service awards has to be an objective, as well as the 3-year funding cycle.
Just this is an exceptional situation. I've worked in the kind of community and voluntary sector for a long time, and it tends to happen. Budgets tend to come quite late, and there was 2.5 million allocated to this fund with the housing executive this year, which is fantastic because it allowed us to do a lot more. But the lateness of the DFC announcement meant, as Nicola had said, very little time to get a really good solid application, and only actually provided, practically speaking, about 6 months of spend. Now we know that fund without some kind of recognition will end on the 1st of April. So we have to take decisions, and what we tend to do with these kinds of pots, because they're so valuable, we will say to people that they're staying with us, and if they can't stay in that fund, we'll redeploy them. We simply have to take that risk and not gamble, and we'll do that. We had got 2 pots of money from that. One, which I want to flag, is the Step In and Step Up project, and that's a specialised support worker to work with individuals transitioning into their own home. So it's very specific, it's very time bound, and the whole push of that is to make sure that their tenancy is right from the very start, in the hope that it won't break down. We could do so much more with that if we had that, because we see and we hear story after story after story. Someone will get the keys, they walk into an empty flat or apartment or a house, or they've got unresolved issues and their tenancy breaks down really quickly. We want to get in through the prevention work on this to make sure that doesn't happen from the outset, to set people up to succeed, and we would love to be doing more, and if we got the nod on 3-year funding, we would do a lot more of it.
Thank you. Just to stay on that, when officials were with us, they told us that the housing executive made, and they described it as savings of 13.8 million over the last 3 years, which was essentially money that they didn't bid for from the department, or that's my understanding of it. But they presented it as a saving to the public purse. So given everything you've said there, you thought about 2-point-something million, but 13.8 million. Everything we know about the effectiveness of that early prevention and intervention, do you believe that 13.8 million should have been spent and invested in prevention services rather than going unspent?
Yeah,
I'm
not full of the detail of it, but absolutely, yeah. I think if we are making savings for the public purse, that then should be rediverted into prevention schemes. But I'm not fully over the detail. Mark possibly might know.
I'd merely add to that point that if that saving is that 8.8 million was saved, I'd be wondering why more of it wasn't allocated towards supporting people, for example, which has not been able to keep up with inflation. And again, it would be very interesting to understand the full detail of that, considering the range of needs across the homelessness sector here. So again, I'm not sure. I don't think it can be. You can just simply say there's 13.8 million that could have been spent in a different way. I think it's more complicated than that. From when I listened to it 2 weeks ago and heard that said. But certainly, if that was the case, there would be several things you could spend it on. But one of the top ones would be homelessness prevention, yes, and then the supporting people program.
I picked up on that number as well, David, I have to say, and I'm not sure whether that's a financial treatment issue. So I don't know whether that was £13.8 million that was readily available to put somewhere else, or whether that was a saving against a projected target. So for example, if you think something's going to cost you 50 million and it doesn't, it costs you 36 million that you've saved, 13 you haven't, you still spend 36 million. So I don't know where that money's coming from. But if there have been initiatives that have saved money to be redirected elsewhere, fantastic. I'd love to know what the plan was and how it was saved, because actually if that's a real thing, let's save some more on it and let's redirect it. I don't know, as like I said, I don't know where that money...
It could be health money, it could be justice, it could be...
Oh, thank you so much.
Thank you, David. And I think that was the point that we're drawing out here too, that it was stated to us in committee that this was savings made, whereas actually it felt to us like it was efficiencies then not drawn down the following year. Just the final topic I wanted to touch on, and I think all of you had mentioned it in your opening remarks, is around the governance. And the Audit Office report had included some criticism of the homelessness governance. And I think, Jim, you'd read out the catalogue of the governance structure, which I think actually was quite helpful just to lay that out. But I want to speak on two particular forums, the Homelessness Strategy Steering Group and the Central Homelessness Forum, and ask you, as a member of these governance forums, what would be your assessment of their effectiveness?
The three of us are on the Homelessness Strategy Steering Group, and I would certainly attend most of those meetings. I think everybody who attends those meetings are very committed to ending homelessness and committed to working together. My question is around the seniority of officials within that and their ability or inability to take and make decisions. So quite often it will be, I'll have to go away and discuss that and then come back. I also think at those meetings that sometimes we focus a bit too much on operations as opposed to kind of strategic wider issues. I think we could work better around that. As I said before, the Interdepartmental Homeless Action Plan is non-accommodation based, and I think that's interesting in itself, because we have the homelessness strategy and then we've got the Interdepartmental Action Plan, and there's maybe something about pulling everything together around that. And then my final point would be around how it's chaired and how it's governed, which I mentioned before, around the possibility of having an independent chair. And say that this is, as Mark had said, this isn't anything personal. The officials are very good at what they do, but I just think in terms of accountability, if the department is creating its own action plan along with other departments, then to chair that and have oversight of that is a questionable arrangement.
I think in your written brief into the committee, you're calling for an independent review of the homelessness governance arrangements, and I think this, building on what you've just previously said, I just wanted to ask you finally across the board, like what limitations and issues with the current arrangements would you want that review to consider, and what impact do you think that would have then on homelessness? So you've sort of outlined maybe seniority of officials as one of them, but anything else? I'd be keen to get your feedback.
The structure's local area groups. There's 9 local area groups, and then we have the Central Homelessness Forum, which would be, I'm not sure how many members are on that. It's quite sizable. It tends to be information giving because of the sheer size of it. It's a very useful forum, and a lot of really topical issues are discussed on it, and it is there to help support the implementation of the Homelessness Action Plan. However, what we would see how we can improve that is to look at a more task and finish type approach to it. We're currently working with the Housing Executive on some of that. The strategy is called Ending Homelessness Together, and we need to work together. So those task and finish groups to take out specific actions within that plan, I think, is a good way of working going forward on that.
Yeah, I mean, the limitations goes back to the power of the group to implement. Was the officials are really committed, they have power to bring resources to the table. And the second piece is that particularly within the interdepartmental piece, is that it hasn't been reviewed since the programme for government has been kind of published, and there's a real need for that to occur in order to breathe new life into this. And it goes back to the point that we've all consistently made: it needs to be promoted within government as well and within the civil service, in order that the real decision makers are around the table and can implement the power of their departments to make real change. because we have to get away from the champion kind of side. We have to get away from the there's no mandatory obligation, you know, and Nicola's kind of point around the duty to contribute, you know, is absolutely essential now at this stage to mandate departments to participate in an overall approach.
And that probably tees me up from what I'm going to say, because my experience of it is the department doesn't have any power to compel other departments to be there, and that's why you tend to get adrift. There was a period where I had been to a number of the meetings, and the individuals, the representatives from different departments, there were different people coming in at different levels, and so they had no experience of previous meetings, and they didn't have any commitment to coming back. So that was the first issue. Departments had committed to things from the very outset, and there was one in particular who just went, no, we're too busy, we're not doing it. And it was the Department of Education, because colleagues may remember some time ago we had come up with a plan that we were going to try and integrate some understanding of homelessness and how it happens in the support mechanisms within the curriculum. And that was written, and that was a job to do with the Department of Education. Just dropped off the radar. So there is that opt-out mechanism there, which was quite difficult. I touched on this. It tends to report on what it's doing rather than what it's achieving, and that's back to outcome. So you can have as many meetings as you want, you can do as many things that you want, but unless you know that you're making a difference. So I would suggest that we move towards that outcome. If we do all of this, what do we expect to see, and how do we know whether we're successful? And there's really limited time for discussion, because there's a hefty agenda and we move through, and it tends to be more reporting than engaging. So it does need to be reframed. I think the Audit Office is absolutely spot on its observations of it.
Like, as you say, you know, you can have all these groups and all these forums, but it's a lot of people talking about the good work that they're doing, but you need to have the action coming through them. And I'm interested in that point that you made there about Department of Education, because just thinking of the Child Cooperation Act there that hasn't really been brought into force, and there is legislation there. Just need to have the buy-in from the right people in the room. Have any members got any further questions on that coming on?
One observation, Chair, was see, look at the future potential homelessness and risk factors. I mean, I'm in the Education Committee, and there's been an exponential rise in children with additional complex needs, which would be a risk factor for homelessness. So unless we get a grip of prevention, you actually are maybe looking at significant challenges in the future.
We have recently launched our research, and it's on childhood adversity. And that was a study done across different providers on the experience that individuals who are with us now, what has happened to them as their life has moved on. And in the majority of individuals who are with us now who are homeless, their homelessness journey started in childhood. It happened because they were unsupported, they were unloved, they were mistreated, they were abused, they were born in poverty and social exclusion, and we can very, very clearly see that if you have a number of those adversities in childhood, that you'll end up homeless. So if we're talking about prevention, we need to, and Mark used the word, get upstream. We need to find out, and we need to get at those young people very, very quickly. And again, just to jump back to my issue, from my stats at the minute, there are 19,000 or more than 19,000 young people. So as they move through life, if they end up homeless, we have an even bigger problem. So I think you're right in raising the issue.
If you've got those risk factors, are there protective factors? I mean, is there a bit of data that says, look, actually, if you have the following 3 or 4 things, you're less likely to ever become homeless?
That'll be the next part of our study in March. So please come along, and we'll share some of that with you. We can see that early interventions,
those things,
early interventions, early spotting, whether it be through an education setting, whether it be through health intervention, whether it be through the justice system, whether it be additional support, we can spot them. What we need to do is now tell you what that is, and we will in the new year.
Okay.
Thanks, John. I just want to invite the Treasury Officer of Accounts. Have you any comments to make, Stuart?
I think, Chair, it's important from a Department of Finance perspective to acknowledge the witnesses' comments today. I think it was Ms McCrudden coined the phrase, it all comes down to resources. And the other comment that I really picked up on was the lack of consistency of funding. And Chair, you will, obviously the inquiries we've had over the last year here, where we've talked about mental health, child poverty, the importance of that multi-year budget is absolutely essential. And it's certainly not lost on us in the department. We're very focused on delivering a 3-year resource budget, 4-year capital budget. There are no doubt tough choices for the executive ministers in the weeks ahead, but we are very hopeful at this stage that we will be able to deliver that. I've worked in public spending for 19 years, and I know that multi-year budgets don't happen regularly enough or often enough, and we need to make the most of that opportunity. And the consultation period and the time ahead, we can hear about the communities committee and the engagement levels there with the finance professionals in that department that is taking place. And I just want to encourage you to keep up that good work in the window that lies ahead here in the coming weeks and months. I think that would be essential to the long-term success in this area.
Thank you very much. And CNAG, any comments, Sarah? No? Thank you. Well, I just want to say a really big thank you on behalf of the whole committee to Ms McCrudden, Mr Bailie, Mr Dennison and Mr Carroll for attending today. It has been incredibly valuable. As I said at the outset, as a committee we really want to get to the heart of this issue and about the people who are at the centre of it, and your organisations, the great work you do, and coming here today to bring those voices has been really, really important in that. So thank you very much, and also thank you to Mr Stevenson and the CNAG for their support for this inquiry. So thank you.
Thank you very much.
Thank you very much, Chair. Thanks, the members. Thanks.
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 Members, if you're content, we'll move into closed session.
Content?